This video, we are going to continue with the arterial supply of the limbs. So to evaluate the different arteries at the level of the peripheries, we start off with the axillary artery. So the axillary, to evaluate the axillary artery, you place your finger as such in the axilla to try to palpate the axilla. So here I'm feeling pulses in the axilla. The next is to evaluate the brachial pulse. So the brachial artery is located medially to the brachialis tendon. To palpate the brachialis tendon, ask the patient to contract. Please, can you do this? Contract your hand. So you try to feel something that is hard here. You go on the medial side of the brachial tendon and ask him to relax. You're going to feel the brachial pulse. Similarly, the radial pulse is going to be located medial. In order to feel the flexor carpi radialis tendon, ask him to, can you do this? You see this tendon. This tendon here is the flexor carpi radialis tendon. So lateral to that flexor carpi radialis tendon is going to be radial pulse. So we have the carotid pulse that is going to be located anterior to the sternocleidomastoid muscles at the level of the direct cartilage. Now we have other pulses. The femoral pulse. To locate the femoral pulse, it is anterior. Can you write down? In order to locate femoral pulse, what you have to first start is flexing both knees. After flexing both knees, you locate the anterior superior iliac spine. You locate the pubic symphysis. The femoral pulse is going to be located at the midpoint between the anterior superior iliac spine and the pubic symphysis, and then you palpate there. You're going to feel the femoral pulse. For the popliteal pulse, you need to flex the knee as such and put both of your fingers underneath. Normally, you have to push up the chest up. Put both of your fingers up, and then you feel the popliteal pulse. The next one is the posterior tibialis artery. For the posterior tibialis artery, is located posterior to the medial malleolus and anterior to the Achilles tendon. So you palpate there. You're going to normally, in order to easily palpate, you can do an inversion motion, such as to reduce the flexor retinaculum at this position, and you can palpate the popliteal pulse. And lastly, the dorsalis pedis. It is located laterally. This tendon here, you can ask him to extend. Can you do this? You have this is the extensor hallucis tendon. So this is the extensor hallucis tendon. You come medially to the external hallucis tendon on, please can you leave, on the navicular bone. You're capable of feeling the flexor, the dorsalis pedis artery. You can go also posteriorly and posteriorly to feel the dorsalis pedis. So from here you have evaluated all the arteries of the limbs. The next evaluation is for the nervous supply of the limbs. Now, for the nervous supply of the limbs, you actually need to know the anatomy of the nervous supply in the brachial plexus and in the lumbosacral plexus. So you should know all the anatomy of this in order, and to know all their supply in order for you to best have the evaluation. And now, the diagnosis you can have with the nerve supply abnormality is lower motor neuron syndrome. Now, what are the elements in lower motor neuron syndrome? The first and the major important element in lower motor neuron syndrome is fasciculation. How do you evaluate fasciculation? So, I will use the ScHRDbb methods where, in order to evaluate fasciculation, you observe the limb and then you slightly tap the limb. You tap, you find if there is any contraction of the muscle compartment. You tap, you find if there is any more contraction of the muscle compartment. You turn, you tap, you find if there is any muscle contraction of the compartment. You tap, you find if there is any muscle contraction of the compartment. If there is any muscle contraction, both on the upper and the lower limb when you tap, it is fasciculation. And fasciculation is a major element in lower motor neuron syndrome. The second aspect is to evaluate for sensation. You evaluate for a sensation in that particular nervous supply, especially the axilla. We'll just take one example. The axillary nerve sensation is going to be located in the upper 1/3 of the arm. So ask if he's capable of feeling at this position. If he's not capable of feeling at this position, it means that there's an abnormality of the axillary nerve. The next after sensation, that's hypoesthesia, that occurs in lower motor neuron seizure. The third element after hypoesthesia, we have the reflexes. In lower motor neuron syndrome, your reflexes is supposed to be hyporeflexia. It means that there's going to be an abnormality of the nerves. The next element, you are not going to have any Hoffman sign nor Babinski sign in lower motor neuron syndrome. And how do you do the Hoffman sign? To do the Hoffman sign, you hold the finger. Please come forward. You hold the finger as such, and then you press at the level of the distal the distal phalange. You press as such. Normally, it's not supposed to contract. If you have any contraction of the finger, it's a positive Hoffman sign that shows an upper motor neuron syndrome. And for the lower motor neuron syndrome, it's a Babinski sign that you have already seen on the central nervous system examination. So those are the major elements that you're going to visualize in a case where you have a lower motor neuron syndrome, and that occurs with nervous evaluation in case of a limb abnormality. The last aspect is the lymphatics. For the lymphatics, you need to palpate. Here you are going to have what is called the trochlear lymph node. If you palpate here and then you feel trochlear lymph nodes, it means that there is an abnormality, particularly an infection or a malignancy. The next thing is to evaluate the axillary lymph nodes. How do you palpate the axillary lymph nodes? You palpate the axillary lymph nodes from the humeral site in order to palpate the humeral lymph nodes. You palpate from the thoracic site in order to palpate the thoracic lymph nodes. You palpate posteriorly in order to palpate the scapular lymph nodes. You palpate anteriorly in order to palpate the pectoralis lymph nodes. You palpate centrally in order to palpate the central lymph nodes. And then you press your hand deeply in order to palpate the apical lymph nodes. So all these nodes are very good in order to evaluate both the limbs and also the torso of the chest. So from here we can say thanks for your kind attention of limb examination.